Well, you were under the influence of more alcohol than you thought. And somehow that amount was interfering with your capacity to drive.
Okay, so you're saying that I wasn't driving well,
Uh, and you weren't noticing it,
and I wasn't noticing.
right? Because somehow alcohol interferes with fine motor skills before it reaches the place where you're aware of that.
Okay,
Right. So when you say 1.8, that measures the amount of alcohol in the blood. That would not be possible because you would have to consume a lot more alcohol than you did to reach a 1.8. So most likely, the policeman told you that the breathalyzer registered a 0.18.
okay.
Okay, and that's the equivalent.
It's very reasonable, because it didn't make any sense to me.
Okay, and that's very understandable given the number of drinks that you had. So I'm going to show you a little sheet here, which will tell you how we measure blood alcohol by what's called standardized drinks. So you can take a look at this. You had both margarita, which goes under the regular drink, and then you can look at the wine.
Okay, so I don't drink beer and I don't drink malt liquor, so I'm looking at the wine and spirits.
Yeah.
So
Right.
wine says 5 ounces of wine is equivalent to 1 ounce of alcohol.
Okay, and how much alcohol is that in terms of percent?
Well, I don't know.
Okay, 0.02.
That's 0.02.
Right.
Okay, so 1 5-ounce glass of wine is equal to 0.02
Blood alcohol.
blood alcohol level.
Yeah, right. Because
Alright.
alcohol proceeds through the stomach very quickly into the bloodstream,
Okay.
and then it goes up to your brain.
All right, and a 1.5 ounce of 80 proof spirits would be equal to 1 ounce of alcohol. So, or 0.02.
Mm-hmm.
Okay.
Yes.
Okay, so I had 5 margaritas, and if you're saying that that's 0.02 each, then that's 0.10. And then I had a glass of wine. Oh, I'm not sure that it was 5 ounces,
Mm-hmm.
but it probably was. So then that would add another 0.02. So that would make it that I had 0.12.
Okay.
And I
but
don't
the
know.
breathalyzer showed 0.18.
0.18.
So the drinks probably were either stronger or there was more of them. So it's possible you had a larger glass of wine than 5 ounces. And it's possible that your son made the margaritas so they had a little more kick to them. And so there was more than 1 ounce of alcohol in each of those. That's what this suggests.
Okay, and I don't know what the legal limit is.
Okay, so in New York State, the legal limit for driving under the influence, it would be called driving while intoxicated, which sounds like what you got pulled over for. DWI is 0.08.
Okay.
So anything above 0.08,
0.08,
you're driving
driving
illegally.
Illegal.
Right. And the reason it's illegal is even though you didn't feel like you were having a bad effect from the alcohol, except you were a little bit tired, you didn't notice that you were weaving.
Well, that's true. So it doesn't really matter whether I had a 0.18 or a 0.12. I was driving illegally anyway.
Yes, so from the legal standpoint, it doesn't matter. But from the standpoint of your health, I think it does matter. Because you didn't pass out from that amount of alcohol. And that tells us that your body can tolerate more alcohol than many people can.
Okay, so I don't know about that. I mean, I don't have this level of alcohol very often,
That's right.
but you're saying that I didn't if I didn't notice it, then that's maybe because I'm used to doing that, or somehow my body is,
Well, I don't know if it's that you're used to it, because there are a lot of reasons why this could be, but somehow your body can tolerate that without causing you to fall over, go to sleep, throw up. So somehow there's tolerance in your body for alcohol. So you can handle more than another person might. Some person under maybe 3 of those drinks would no longer be functioning very well.
okay.
Okay, so
So,
because you have tolerance, you wouldn't know if something was affecting you.
okay, so, I mean,
Okay,
you know, it's kind of, to me, it seems like a little bit like having a long nose or an attached earlobes, you know, maybe I have that, but I don't know what to do from there.
okay. So what we're going to need to do now is to find out if we can look at the source of where this might be.
Okay,
So I'm going to administer an instrument for you. It's called the Audit. It's an alcohol test that was devised by the World Health Organization and has been used all around the world to standardize and validate this instrument. So we can use it everywhere, and it applies to all people. So that's the standardized instrument. I'm going to ask you some questions. You're going to give me the answers, and from that we'll determine what some of the difficulties may be. Okay. So we completed the first part of our interview, and now I'm going to administer a brief instrument, a brief test, which will give us an idea of what may be involved in the problems you're having with drinking.
okay,
So in order to have a test that really measures what it's supposed to measure, and that can measure that over time properly, we need what's called a standardized validated instrument. Now it happens that the World Health Organization has designed such an instrument, very easily administered, as you'll see, that is used all over the world. So the standardizing population is everybody. They have people from every country, males, females, older, younger, different races, doesn't matter. So this applies to all human beings because the physiology of the intake of alcohol applies to all human beings. We're all people, Homo sapiens, so we react to alcohol. Some people differently from others, but basically in the same kind of way because of the way alcohol affects our brain and behavior.
okay,
All right, so I will be giving you a series of questions here. Let's see if there are 10 questions, and we will look at those and see what kind of score you come up with and whether that score indicates hazardous or potentially dangerous drinking or not.
okay.
Okay. So I'm going to read you the first and then down through the 10th of these questions, and you will tell me the answer.
Okay,
So we've already talked about standardized instruments, right? I mean, and we also talked about how much a standard drink is.
yes,
Okay, so you know that a standard drink of alcohol is 0.02 blood alcohol level that results from that. The amount of alcohol that then is present in your bloodstream after drinking a standardized drink should be about 0.02. Okay. So, first question, how often do you have a drink containing alcohol? Never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, 4 or more times a week.
well, I pretty much have a glass of wine with dinner every day, so 4 or more times a week.
Okay.
Okay,
So you have a score of 12.
All right.
According to the World Health Authority, a score of 8 or more is considered to indicate hazardous or harmful alcohol use.
Okay, so I'm hearing that I'm undertaking hazardous alcohol use.
Yes, that the experience that you had indicates hazardous use of alcohol.
Okay, and it sounds like more than that. It sounds like my score is high enough to say that even without that, I might be at risk or something.
Yes, because that amount of alcohol, you actually could consume it without feeling any major effects from it. There are many people, if they had that many drinks, they'd be sloshing around and they'd fall over. They certainly wouldn't be able to drive. They wouldn't even be coherent. That's a lot of alcohol.
Okay, I mean, that's surprising to me, I guess, but, all right.
Yeah, and this isn't a fault. It's just something that happens in people's brain. Some people can process a lot more alcohol than others. And it seems like you can without suffering the kind of effects that another person might have. So you didn't even consider not driving. And you thought your driving was normal.
Uh-huh,
And you even had wine with a little stop-off at that inn,
right,
on top of having had those drinks.
uh-huh,
So another person might have been so affected they wouldn't go near a drink.
right.
He might have eaten.
You know, my father often said that he thought that that was a strength, you know, to be able to hold your liquor, you know. That was the-
So a lot of people,
What he said,
yeah, it's an old-fashioned belief about people being able to hold their liquor. They also call that a hollow leg, you know, that the alcohol goes in the leg. You know, they can drink huge amounts. Well, you can't, but for those people who can, some bad things can happen to their health, or they could have an accident, something can happen, because they don't register what goes on with the alcohol.
uh-huh,
So, in some sense, this has allowed something to happen that brings you to look at this.
uh-huh,
Being arrested, pulled over, having your license suspended actually allows you to evaluate whether you want to continue to drink or not.
okay. You know, all right, I mean,
So we're
like I
going.
said, I'm just not, I mean, this is new, and
Sure.
I'm just,
I
don't know
understand.
what to do, but I'm happy to do whatever I
Yeah,
have to do.
and because we consider this a medical event, your insurance will pay for any treatment that you have here.
Okay,
So we're going to give you the kind of help that we think you need, which is to understand the effects of alcohol and what it may be that allows you to drink or changes your thought process so you think about drinking or drink more than you ordinarily might do.
okay,
So in order to do that, we have to give you some form of treatment at this clinic. We do our treatment in the form of classes, and you will come twice a week to a class that lasts an hour and a half each time. And we'll give you help and training in a technique called cognitive behavioral therapy, or CBT, where you learn how the thoughts and feelings and actions go together.
okay.
Uh,
I've heard of cognitive behavioral therapy, I
Right.
just, of course, I've never
Right.
done anything.
Right, and it's a short program,
Uh-huh.
twice a week for 6 weeks.
Oh, wonderful.
Okay. When you come here, we have the authority to recommend that having started treatment, you can get a conditional driver's license.
Okay,
That means you can drive to or from work, you can drive to or from a grocery store, and any of the other very basic things you need. You just can't do social driving.
okay. I
So
mean,
that will
that's-
allow you to not be punished. You will earn your living, you'll do your work. We also, at the end of this, when we understand that you now know about alcohol and you understand what it is that you need to do to drink responsibly or not drink at all, we will recommend full restoration of your life, of your driver's
Okay, so if I finish, and then I suppose there's kind of a test or something. that-
Well, we'll test you along the way.
Uh-huh.
Each particular session, or two sessions, will give you an examination to see if you've understood the material.
Okay.
It's very basic, but it's very important.
Okay, so I'm happy to sign up, just tell me.
Yeah, so
Point
what
me
we're
in
gonna
the
do,
direction.
yeah, I mean, you seem like an open person. You seem like you can understand what's happening, even though, like many people, you never thought about this before. So we think you will do well in this course. So I'm going to send you to the front desk. They're going to make an appointment for you for your first class.
Okay.
And that can start, depending on what our situation is, either later this week or beginning next week. And you'll come to 2 classes a week of an hour and a half each for a period of 6 weeks. Then we will have completed the work. And if in that time you remain clean and sober, and we can test you to make sure of that by giving you breathalyzer tests.
So I shouldn't drink that 1 or 2 glasses of wine at night
No,
with it?
you're going to attempt to be clean and sober.
Okay.
That's what we want to see.
In other words, no drinking at all?
No drinking.
Okay.
Right. And we'll test you to make sure that what you're telling us is the truth, not that we don't think that you would be, but this will be valid. It will validate that you're not drinking. And then at the end of 6 weeks, you will get, we recommend your full license return. And hopefully you will have had all the material that you need to make responsible decisions about whether you should drink or not. And if you do, how should your drinking go? Okay, so you'll go to the front desk and they'll make an appointment for you, and we'll start either end of this week or beginning of next week.
Okay, wonderful. Well, that sounds very straightforward, so thank you very much for sitting with me, going through all the educational materials, and
Yes.
I'm happy to start.
Yes.
So
and
will I
you-
see you in
Yes, you will
classes?
see me. I am one of the instructors who runs the group.
Okay. All right, it's been very nice meeting you.
Thank you. I'm so glad that we met, and at some point, I think you'll understand that the officer who pulled you over did you an enormous favor. Take care.